There are several methods to multimodal remedy for patients, from medical trials to traditional processes, and the entirety in between. Treatment orders and options are quality determined on by way of specialists, based totally on affected person health, the level of cancer and other critical factors. Multimodal therapy entails the usage of numerous treatments to lower the mesothelioma cancer cells, forestall the spread of these cells, or improve existence expectancy for patients. At the same time as there are several factors worried in selecting the order of remedy, speak along with your specialist about treatment options or scientific trials, is the great manner to decide the proper approach for you. Multimodal remedy makes a specialty of disposing of cancerous tumors, with several remedies for top-rate consequences. Multimodal therapy is adapted to each affected person's particular case. The most used multimodal remedy approaches are radiation and chemotherapy. This is administered earlier than, during, or after surgical operation, at the same time as multimodal processes and treatments may be noticeably effective. They are now not constantly the high-quality alternative depending at the after surgical operation. At the same time as multimodal processes and treatments may be noticeably effective, they are now not constantly the high-quality alternative depending at the remedy is the first-rate option. Mesothelioma multimodal strategies. There are two fundamental techniques to multimodal remedies for mesothelioma patients, and neoadjuvant remedies are similar, however vary based totally on the order of use at some point of treatment. Adjuvant remedy, used frequently after surgery. The adjuvant remedy is taken into consideration additional remedy to minimize the risk of most cancers returning. At the same time as surgical procedure, eliminates as a great deal of seen cancer cells as possible. Microscopic bits may additionally remain undetected, and additional treatments might also prevent any returning cell increase. Treatment options for adjuvant remedy can also consist of chemotherapy, anti-most cancer capsules that input the entire frame into the bloodstream to kill most cancers orally or through veins. Radiation remedy, excessive powered power beams, like X-rays, that input the frame internally or externally to kill most cancer cells. Adjuvant radiation therapy targets the region around the unique most cancer's location to reduce the threat of recurrent growth. Immunotherapy, a technique of running with the frame's immune system to fight off the last cancer cells via stimulating or supplementing the frame's defenses. Targeted remedy, used to adjust precise abnormalities in certain most cancer cells to goal the unique features, and use focused remedy pills to work on eliminating those cells. Hormone remedy, evaluation of cancerous cells. Every so often reveals a sensitivity to hormones. Remedies to forestall the hormone manufacturing or block the effect of the hormone can be beneficial. Adjuvant therapy is not beneficial to all patients, and the potential aspect consequences of those treatments can be severe for some patients. Please seek advice from your health practitioner approximately those factors while discussing treatment options. Neoadjuvant therapy. Adjuvant therapy used earlier than the primary treatment of mesothelioma is known as a neoadjuvant remedy, and is used often to make radiation or surgical procedure greater effective and less complicated. Given as a primary step in treatment, typically before surgical treatment. This works to reduce tumors as a form of initial care, induction therapy. Remedy alternatives for neoadjuvant remedy might also consist of chemotherapy, anti-most cancer tablets that input the complete frame through the bloodstream to kill cancer orally or by means of the vein. Radiation remedy, high-powered energy beams, like X-rays, that input the frame internally or externally to kill cancer cells. Adjuvant radiation therapy objectives: the region around the authentic cancer location to lessen the chance of a recurrent increase. Hormone remedy, evaluation of cancerous cells from time to time, famous sensitivity to hormones. Treatments to forestall the hormone production or block the effect of the hormone can be beneficial. Neoadjuvant remedy isn't always beneficial to all patients, and the capability facet effects of these remedies can be extreme for a few sufferers. So please seek advice from your medical doctor about those factors when discussing treatment alternatives.